Have you ever noticed how the names we use for certain medical or psychological conditions can change over the years? This isn't just about sounding more modern, it's often a sign of a deeper, evolving scientific understanding. Before it was known as dissociative identity disorder, this complex condition was indeed called multiple personality disorder. The shift in terminology reflects significant advancements in how mental health professionals conceptualize and diagnose this experience. The change occurred in 1990 for when the American Psychiatric Association updated its diagnostic manual, the DSM-4. This revision moved away from the idea of entirely separate personalities residing within one individual. Instead, the focus shifted to understanding that the condition involves a fragmentation, or splitting off, of a person's sense of self and identity. Think of it less as multiple people inside one body, and more like different facets of one individual's identity not being fully integrated or connected. This fragmentation often leads to distinct states of consciousness, memory, and perception. Understanding this distinction helps clarify that individuals with dissociative identity disorder are not creating new personalities. Rather, they are experiencing profound disruptions in their self-awareness and memory, often as a coping mechanism for severe trauma, typically experienced in childhood. This reframe helps to reduce some of the stigma associated with the older name and emphasizes the core dissociative aspect of the disorder, meaning a detachment from reality. One fascinating aspect that informed this change was the concept of ego states. These are organized systems of behavior and experience that are separated by some kind of boundary, but are still part of the overall personality. In dissociative identity disorder, these ego states become more pronounced and distinct, influencing memory, feelings, and actions. This scientific nuance highlights that while there may be different identities, they are fundamentally parts of the same person navigating immense challenges. So, the journey from multiple personality disorder to dissociative identity disorder isn't just a linguistic update. It represents a more accurate, empathetic, and scientifically informed understanding of a challenging human experience. This clearer terminology allows for better research, more effective treatments, and greater compassion for individuals living with this condition, ultimately helping us all better understand the complexities of the human mind.